Disclaimer alert, disclaimer alert. Hey everybody, it's Dr. Joe. I've got Molly and Bailey with me today, and they're gonna help me show you guys some dog rehab therapy. I know you guys love your dogs as much as I love them, and they need therapy sometimes too after injuries or even surgeries. So first I'm going to show you on Molly just an injury that's very common for dogs, and that's an injury in their knee that's just like in the humans. A lot of times we hear that somebody tore their ACL, and that is basically a ligament in the knee that prevents the knee from sliding back and forth. It is the same in the dogs, except theirs is called their CCL, which is their caudal cruciate ligament, which is their back leg. It's very similar in the fact though that if they have torn it, if they're very athletic dogs, the vet will test it just like humans test in the knee, which is called a Lockman's test. So you're just pushing forward to see if there's a shift, and luckily for Molly, hers is nice and solid right here. Once they end up having their surgery, most of the time they can actually start their therapy right away, and it'll just depend on the vet and what kind of surgery they do. Very rarely they will get casted and have to be in a cast for a while. Now Molly's doing a nice stretch so you can see how long her leg gets. If you are working on their leg, you probably want to massage it a little bit first, just making sure that the muscles get nice and loose. You know, they're not able to run around and loosen it up for themselves, so you can give them a nice doggy massage and get a lot of extra hair and just kind of push it off to the ground. But once you massage it a little bit, get it nice and loose for them, you want to start giving them some motion in their legs. And you want to start at the end, we call it the distal end, and their legs are just like ours, where this is their ankle here, which would be our ankle, and then this is their knee, and then this is their hip. So you want to start off at the ankle and just get some movement, kind of pushing it back and forth, just like you would do the range of motion on yourself. So pushing it into a plantar flexion, dorsiflexion, plantar flexion. Do that about 10 times, and they can bend their leg. It doesn't have to be straightened out like that, but just nice and gentle. If they cry a little bit, then that's probably too much, and you don't want to hurt them. You just want to keep that movement in there. So then the next is going to their knee, and so most of the time this is where the surgery is, so you want to be really gentle with it, but you can be gentle but firm, which is holding it here to help stabilize it, holding it here, and just bending and then coming back, bending and coming back. So 10 times with that. Yeah, she's doing fine with it, and coming back. Now after surgery it's going to be a lot harder than this, but again, you can be firm, but if they cry out a little bit, then you're probably pushing a little too hard. And again, ask your vet, because they'll let you know how much you can push for them. They also, if they have a scar, you'll want to do a little scar massage once it heals and scabs over, and you're just taking the skin like I'm doing and moving it back and forth, and that will help lay the scar tissue down. You can do about 2 to 3 minutes of that every day for them. You like that part? Yes. All right. And then you can move up to their hip joint up here. Most of the time it's easiest just to actually kind of swing the leg front to back. So this would be like a hip flexion for people and a hip extension. Usually when you go back, see how their legs straighten out, that's fine. That's kind of what you want to do. But again, you want to kind of stabilize it here so they're not moving their whole body all over the place, but they're just going front to back. 10 times each of those. And then finally, but do some circles. So you're actually just kind of moving it sideways, up and down. It'll help keep that hip moving for them. So just kind of up and down a little bit. So probably 2 times a day for them, and then she's done and ready to go. So the next exercise I'm going to demonstrate on Bailey. If you want to get more weight through their leg, the best way to do it is actually pick up their front paws, because after a surgery they don't actually know what to do with that leg. They don't know that they have to put weight on it to get it stronger, because it just hurts and we can't explain it to them. So if your dog is not super heavy, grab their front paws and just bring them up, and if they're not like Bailey, they'll actually stand on their feet. But I'm going to try one more time and see if I can get her to stand up. All right, so stand them up and then grab their front feet, and that's how you do it. And you got to give her some kisses to make her happy. So just looking at puppy tummies are cute, and just try and hold them up there for about 30 seconds to a minute, and then have them come back down. So there you have it. That is your dog therapy with Bailey and Molly. I'm so glad that they decided to help me out on this one. If you have any questions, leave them in the comment section. If you'd like to check out some other human videos, go to AskDoctorJo.com. And remember, be safe, have fun, and I hope you feel better soon.